Hello and welcome to Press Conference. I'm your host, Jim DeLorenzo, the principal of Jim DeLorenzo Public Relations. You can find me online at jimdelorenzo.com. A reminder that I'm always available to answer your questions about public relations, how it works, what it is, how it can help you. Please feel free to contact me via email, jim@jhdenterprises.com, or on LinkedIn, or on Twitter, where my handle is @jhd16. In my public relations career, I've had the good fortune to meet many interesting people: athletes, entrepreneurs, reporters, coaches, authors, executives, editors, entertainers, and innovators. My guest today is Cheryl Peltekis, a serial entrepreneur who is the co-owner of HomeCareSales. She is also the vice president of the board of directors of Immediate Homecare and Hospice, which is an agency she founded in 1994. Cheryl is also the author of The 5 Steps to Sales Success. As the co-owner of HomeCareSales, she and her business partner, Melanie Stover, have taken on the mission to help get people the care that they need and want delivered in their home. Now, Cheryl, you and I met for the first time a few months ago,
Yes.
and I've been interested in learning about your career as we've had some discussions and conversations. And I know that you got your start in business as a registered nurse
Yes.
in the state of Pennsylvania,
Yep.
and at Pennsylvania Hospital, I believe it was.
Yes.
How did you make the transition to working to help get patients their services in their home from being a RN to where you are now?
Well, Jim, first of all, thank you for letting me come today. I really appreciate this opportunity to see you again.
It's a pleasure.
And I did start at Pennsylvania Hospital. I was blessed that they had given a scholarship every year to a student that they would pay for that student to attend nursing school. And so I was the proud recipient. And when I received that scholarship from them, I had to do 3 years at the hospital to pay back that tuition.
Okay.
And I knew, though, from in nursing school, I really fell in love with my home health rotation. And I also kind of grew up unique where my mom and dad were full-time caregivers. So
Right.
I had my grandparents, and I think we had talked about
Yes.
this together last time. I had my grandparents live at our house. A great aunt, my great grandmom had Alzheimer's. My mom would pick me up from school with her in the car. So I kind of saw the receiving end of where agencies or seniors that needed the support in the home. And I saw that sometimes, my mom would not get the services that she could have used.
Sure.
And I think there was just a lack of knowledge in not knowing what home health could do or what private duty services could do. Even hospice, what could hospice do for a loved one? And it really, I think, impacted me so that I knew that once that I was done working in the hospital, I immediately asked to transition to their home health division.
Okay.
And I just fell in love with that.
Now, what a home health division of the hospital, what type of things do they normally do?
So they would see any patients that were getting discharged from the hospital that would need to have services at home. So if somebody did a hip replacement, you would go in there and make sure that their wound was healing, that if you had to take out their staples, if they had to have their blood levels checked because they may have been on a blood thinner, physical therapists to come in and put a plan of care in place.
Okay.
So all those great things, that we can do in skilled services. And I worked for the hospital system for a couple years and came home one day at the age of about 25 and said to my husband, I have this crazy idea. And he's like, great. I said, I'd like to open up my own home health. And he's like, okay, sure, go ahead. So I remember picking up the phone, because there was no computers back then when I was getting into this, and calling the Department of Health and asking if they would send me the books that I would need or whatever the process was for me to get started.
Okay.
And I'll never forget, Jim, I came home from work one day and my husband had gotten the box from the Department of Health and he unpacked it for me, so nice, right? And he lined it up at the front door and it was 13 binders that were about 6 inches thick.
Oh, wow.
And really what I think my husband was doing was he was looking for that moment of weakness where I would have...
To see if I'm not going to do this. I've changed my mind.
That's exactly what I think he was hoping for.
And you did not change your mind.
Instead, I actually flipped the switch, right? And what I did was I said, that's all I have to get through. I can get that done.
Well, that's great.
And 6 months later, that's when I opened up my first business, which was my home health agency.
Okay. And what types of people were you dealing with as patients or clients?
Yeah. So me and my husband is also a nurse, and we
Okay.
both worked at different hospitals, so we had some relationships with some of the physicians.
Oh, okay.
So we were able to go out and see the physicians and say, hey, do you remember me from the hospital? Do you
Sure.
remember me when I worked with you with a different patient from home health? I opened up my own business, and I'd love to be able to take care of some of your patients. And they were like, okay, I'll love to give them to you. So in the beginning, we grew so fast, and
Wow.
it was just like they were so thankful to have somebody else in the mix seeing patients.
Yeah.
But then things didn't stay that way for long. A few years into the business, around 2008, we started to see a slip in our market share.
Okay.
And what happened was, very quickly, about 100 more providers moved into the Philadelphia market.
Well, that's interesting.
At the same time, Medicare started to get into Medicare Advantage plans.
Okay.
So they decreased our reimbursement.
Right.
So we were kind of feeling it on both sides, where our revenue was down as well as losing some market share. And I remember in 2010, getting called into a finance meeting, which as a nurse, I hated finance meetings. They were like, for me, oh no, really,
Right.
do I have to go? And I remember my husband being like, you need to be at this one. And I never will forget, the accountant looked me dead in the eye and he said, you're going to be bankrupt in 1 year if your path continues on the way that it is. And boy, there's nothing like fear and pain
Sure.
to motivate you.
Now, what steps did you take to change that situation? Because that's kind of a turning point.
It really is. And I'm a nurse. I mean, what do I know? I knew about caring for patients.
Right.
I knew that I had this deep-seated passion to get care for people that were in their homes that needed the help.
Right.
But I didn't know anything about sales and marketing. And so I immediately went on and looked to see if I could find boot camps that were around the country to learn sales training.
Oh,
So
okay.
I very quickly went to 5 different sales boot camps. And I came home, and I remember getting off the plane. My husband was outside waiting to pick me up from the last boot camp, and I get in his car, and he says, so tell me the great news. Like, you've got this now. You're going to just blow up our business. And I remember getting in the car and looking at him, and I said, we're in big trouble. And he's like, what? What do you mean? And I said, well, none of the salespeople made me feel good about going out and doing sales. Like, I felt like a used car salesperson.
Right. And it's kind of an odd sales pitch
It's
to
so
work,
weird.
because you're working with patients, you're working with doctors, you're in healthcare. You're not necessarily trained. You're definitely not trained to be a salesperson.
Correct. So it really was out of my comfort zone.
Yeah.
So I had to really quickly figure this out, right? So what I was able to do is, I've been an avid reader my whole life. I
Okay.
probably read about 50 books a year. I just love to read, and I read all nonfiction. And something that I had read, I remembered like in my brain saying, I got to go back and find that piece of information that was all about, kind of snapping a puzzle together in business development. And what I was able to do is I sat down and I wrote what I called the 52-week sales plan. And I made myself have a message that I would deliver to each of the doctors or the skilled nursing facilities or the hospitals. And that message was all about educating them on the benefits that the patients would receive if they were referred for services.
Okay.
So when I put on that hat, that I was actually really helping educate them about how to refer and what a patient would look like at the end of working with my agency,
Right.
it made it a lot easier for me to talk to them, because it was all about the patient receiving a benefit.
Sure.
And not doing a yucky sales call.
Right.
Now, the difficult part still was, even though I have to go and talk to these docs and I got to get them to refer to me, is how you get past the gatekeepers. You have to still build all those relationships. So going to some of those sales trainings, I was able to use that. And then with that 52-week sales plan, not only were we able to get referrals coming in, but I was able to then build a sales team that was able to take that 52-week sales plan and replicate that success.
Okay.
And what ended up happening is that within 10 months, not only were we able to get the business back in the black, but we actually had a $200,000 profit at the end of 10 months.
Wow.
So
That's quite a turnaround.
we were so blessed. I mean, it was great work, but it was wonderful that I was able to figure out a pathway to get more
Right.
patients identified. And it really felt like, I joke about this a lot when I talk at places and I'm on stage. I talk about putting on a superhero costume. Because for me, I felt like going out and talking to these accounts or these doctor's offices and the social workers, I felt like I was so empowered because I was really helping patients or people get identified to receive care.
Okay.
So
That was your superpower.
it really was.
You were
It
bringing
really
this
was.
information and helping these people out.
Yeah, and it brought referrals in and allowed us to help more and more people, which is where I was so passionate about.
Wow. I'd like to continue with this. We're going to take a quick break for some commercials. We'll be right back with Cheryl Peltekis in a few minutes.
Why should you choose Rowan College at Gloucester County? Low cost. The #1 nursing program in all of New Jersey. More than 70 programs of study, including selective admissions. With record enrollment. A premier partnership with Rowan University. Transfer options with numerous universities. 4-year degree options on our campus. Rowan College at Gloucester County. Now you're thinking.
Choosing Medicare coverage can be a very confusing and complicated process. Help is just a phone call away, 856-226-4800. As a licensed insurance agent, I'll assist you in making an informed and confident decision on a Medicare plan that meets your needs, lifestyle, and budget. Call me today for a free, no obligation Medicare benefits consultation, 856-226-4800.
When did you see the sign?
When I needed to create a better visitor experience.
Improve our workflow.
Attract new customers. That's when Fast Signs recommended fleet graphics.
Yeah, now business is rolling in. Get started at fastsigns.com.
What do I want to be when I grow up? Maybe a musician? A veterinarian? Maybe an equestrian? A mommy? Well, why not be all these things and more? Consider joining me, Dr. V, with friends and colleagues as we explore.
Hello, welcome back to Press Conference on RVNTV. I'm Jim DeLorenzo, your host, and my guest is Cheryl Peltekis, and we're talking about her business as co-owner of HomeCareSales in the Philadelphia region. And we were talking about how you overcame a challenge back in 2010, 2010, where you had you were close to bankruptcy, or if you had been in business for another year as you were, you needed to make some changes.
Yes.
And you went out and did some sales training and learning this rope and put together a sales plan and built a team. How many people, what from that moment to where you are now, like when did you start HomeCareSales?
Okay, so after I had done the 52-week sales plan, had some success, built a sales team of 3 other reps besides myself, and then added another nurse eventually.
Okay.
And we were able to turn the company around. During that time, we
And
used...
that company's still in business, correct?
Yes, it is.
Okay.
Yep, and 5-star rated, which is amazing. We're doing phenomenal things to serve some of the poorest people in Philadelphia, and we're really proud that we accept every payer. But during that time that we were able to turn around that company, we were using a CRM that was a Fortune 500 company. Their name was Playmaker. And Playmaker, about 3 years later in 2013, was having a contest for Sales Manager of the Year.
Okay.
And the last day that they were taking nominations, my husband decided to nominate me. So when...
But did he do this without telling you?
Yes.
Okay.
So when my husband
He seems to be doing those things a lot along the way.
So he did that, and he surprised me. And little did I know, though, that when he did that, that I would be one of the 3 finalists that they chose to come to their conference and actually present to the audience.
Oh, wow.
And the audience was going to vote on who they wanted as the Sales Manager of the Year.
Now, had you ever done anything like that before?
No. In fact, I had not even spoken really to a large audience then. So
Okay.
it was quite nerve-wracking. And of course, like the first 2 people that were ahead of me were Ivy League graduates of like wonderful schools, had all these degrees in business development, masters, and their MBAs. And I was like, wow, I'm just the nurse. But I walked away that day with winning that contest.
Well, that's
And
fantastic.
at the same time, some of the people that were using the same CRM were very interested in learning how I did what I did,
right,
and try to show them the success. So I took on about 10 of their mutual, I would say mutual clients now,
okay,
but 10 of their users, and helped them. And I did it for free. I wanted to see if I took the strategies that I was utilizing, could they then get the same levels of success
right
at their organizations.
And how did they do?
They did phenomenal. They were able to do as well, and some of them even better. So it felt so good to help them that I finally decided, you know what, I could probably serve more patients if I would really get into consulting, where I taught all of their business development people what they could do to help more people. So it gave me the chance to increase my footprint.
Yeah. And increase your influence and increase the opportunities for the end users, the patients, as the clients.
Absolutely. So during that time period, I had gone to a sales management training class. I wanted to really get some great ideas on how were other successful organizations running, like how were they managing their sales teams. And so I happened to go to one, and I was able to meet my now business partner, Melanie Stover.
Okay, and what was she doing when you met her?
So she used to be an occupational therapist.
Oh, okay.
And so we immediately connected because of the clinical component. And so I just fell in love with her immediately when she started talking about how much she admired the services, and that's what made her go out and sell. And she actually got pushed into selling. She was working as an occupational therapist servicing patients. And the company said, you know, if you want more patients to see, you got to go out and get them.
Okay.
So she got tasked with getting forced to go out and do sales, and she fell in love with it.
How about that?
So now, at the time she was doing the sales management class, I met her, and me and her just became instant friends.
Yeah.
And then that was probably back in 2010. In the next 3 years, I was working, doing some stuff with Playmakers clients, and just basically some free work.
Yeah.
I also wrote down all the steps that I took. And with that, I published a book.
Right.
And then opened up a consulting company. And 6 months later, Melanie approached me and said, hey, I'd love for you to partner with me. And so together we reconnected, and together we're HomeCareSales.
Now, what is the mission of HomeCareSales now? Now that you're together, you've been together now 6 years?
It's been a while, yeah.
6 years together?
Wow, it's already 2019.
Yeah.
Isn't that something? It's like time flies when you're having fun, right? I'm getting old, Jim.
No, you're not. You're not getting older, you're getting better.
Yeah, like wine. That's what my husband says. You're like a fine wine, right? But me and Melanie are really on a mission of trying to help get 1 million patients identified to receive care.
Oh, wow.
And the real reason for that is that we feel that there's a lack of knowledge, that the physicians are not really taught anything at all in their curriculum about home health services, about private duty services, or really even about hospice. You know, they're not sure what makes a patient eligible or what makes a patient qualify. You know, and they're kind of tasked with so much paperwork in our industry that it can be very frustrating for them. So a lot of times they may even shy away from getting a patient the resources that the patient could really benefit from.
Because they don't have the time or the expertise to devote to that question. And it almost seems like sometimes it's private practices and hospitals are almost like mass marketing. You're not really focused on the individual patient as much as you would like to be.
You're right. You're
It's a volume
absolutely
business.
right. And I think that now everybody's interested in the best outcome for the patients with the least amount of cost. Well, in-home care is the least amount of cost. So
Interesting.
that's where they should be sending patients.
Right.
They should be getting them the services that they need. And if they want to remain in their home, let's help them do that.
Okay, so your role as a nurse, a registered nurse, you learned about sales techniques, but you're not really a salesman so much as you are as an educator and an advocate, I would say.
Absolutely,
Yeah.
absolutely. So what me and Melanie have done was we made an online virtual academy that comes with live coaching.
Oh,
So
wow.
they can go ahead and purchase our HomeCareSales Academy, which is teaching them everything that they need to know about a sales process that's repeatable and that's been proven to work throughout the country. And it comes with coaching with me and Melanie once a month. We do a group coaching and a group role play.
Okay.
So we're using some great little strategies. We put people in individual little rooms that we're able to do a role play with so that we can get that sales rep to
Yeah.
practice their messages with us.
Now, is the sales rep for, somebody that works at the hospital, or is it somebody that works at the home care
They
company?
typically work for the home care agencies, or they could work for the hospital-owned home health or a hospital's hospice.
Gotcha.
It's really all the different service lines in the post-acute world that me and Melanie can help.
Okay, so it's not necessarily going directly to the doctors, it's going directly to their representatives who are out there
It's
finding
all of
ways
it.
for the
You
care
know,
of the
it could
patients.
even be going to attorneys, right?
Okay.
Because there's some attorneys that are legal attorneys that
Sure.
are helping people with retirement.
Guardians and retirement
Absolutely.
plans and.
Absolutely.
Yeah.
So it's, you know, all of those types of facilities, as well as the physicians and nurse practitioners. It's really anybody that's able to identify a patient that could potentially benefit from care.
Right. Well, that's interesting because now, how many home care agencies or groups do you are, say, in the Philadelphia metropolitan market?
A lot.
Yeah.
A lot. In fact, I was just talking to the Department of Health yesterday, Friday,
Okay.
and he shared with me that there was 5,000 home care providers in our state.
Wow.
That's a lot.
just
of
in Pennsylvania
providers.
alone.
Just home care, and that's
Yeah.
not even the Medicare certified agencies. So, I mean, there's a lot of providers that are in town, but you got to make sure that, you know, who are you working with?
Right.
You know, and as a patient care advocate, which is really what I call myself,
Yeah.
you know, I want to make sure that people are looking at this, at the Medicare.gov has great resources that you can look up somebody's rating. You know, how are they doing in the industry? You can look to see if a company is accredited by an accrediting body. You know, there's 3 different accrediting bodies right now that will go around, and it's basically like where you're getting a seal of good housekeeping
Right.
approval.
And I know you're going through a process right now with your agency.
Yep.
But what are the 3 accreditation?
So I hope that I don't mess them up.
Okay. I'm
It's
sure
the
you won't.
American Academy of Home Care, maybe. It's like
Okay.
something like AHC. I apologize to that organization. CHAP is the other one, and Joint Commissions.
Okay. And these go around and look at certify the
So
agencies.
these write the book of standards, and they
Okay.
basically say, you know what, above and beyond whatever the government says or your state says, these are standards that are written to kind of reach an optimal level of perfectionism.
Okay.
It's kind of like you're going to hit these standards that are set at the highest level of infection control, at training your staff.
Okay.
So it's all about ways that you can improve the organization so that the patient will ultimately have that highest health outcome at the lowest cost.
Interesting. Highest. Could you say that again? Highest.
Health outcome, meaning if there's something going on, like let's say, God forbid, you had a heart attack.
Right.
Your goal may be that you want to start to live your life again. You want to get your energy
Right.
back up. You know, you want to be able to feel successful and understanding what it means to have a smart diet.
Right.
And control your blood pressure. So in home health, we've got to come in, not only monitor your vital signs and see how you're responding and how you're healing, but we've also got to do that education with you.
Sure.
We've got to take you through that journey and motivating you that lifestyle choices that are going to have to be put in place are actually going to benefit you and make you feel different so that you can buy into it. And you've got to then celebrate those little milestones
Right.
that a patient makes to to reach those health goals.
Okay.
So when we say outcomes, we actually measure outcomes. Like there's a standardized assessment that we have to use in home health. And if a patient started with a wound, by the time that we discharge them, how is that wound?
Right.
So they actually measure that, and then that's publicly reported on Medicare.gov.
Interesting.
Yes.
Now, if our viewers wanted to get in touch with you to learn more about home care sales and some of the other activities that you're doing and wanted to reach out to you for some resources, how would they contact you?
Just my email's great. You can also find me on LinkedIn, just
Okay.
like you. But my email is Cheryl at HomeCareSales.com.
Okay.
And my website is HomeCareSales.com.
I recommend anybody has questions to take a look at Cheryl's website and send her an email. or if not, you can't reach her, reach her through me. I'll be happy to pass along the message. I want to remind our viewers that I always look forward to hearing your stories. Feel free to give me a call at 215-266-5943 or email me at jim@jhdenterprises.com. And I remind to everyone that everyone has a story, but not everyone knows how to tell it. And I want to thank you, Cheryl, for telling your story today. We've got part of your story today. I'm sure there's so many more things we could talk
Jim.
about.
That's so nice of you. And I told you I want somebody to ask your story.
Well, we'll sit down and talk about that. Thank you, everyone, for watching our press conference today. We'll see you next week.
Thank you.